inhibits the production of or the release of neuroepinephrine into your blood from the brain.
Okay, and what is neuro?
It's the thing that increases your like your heart rate and like makes you like hyper aware of your surroundings. It's almost like adrenaline. It's like where it's kind of like adrenaline, but it's usually released at the same time as adrenaline.
Okay.
But it's like what causes panic attacks.
Okay.
And stuff like that.
I see. So there's triggers for it.
Yeah. Well,
and
they're trying to show like how you like anxiety patients, like if you inoculate them like a certain type of bacteria in their gut, like how that could act the same way as like has the same effect as like putting them on like a bunch of antidepressant and like anxiety medication.
Really?
Yeah. So like Prozac. So they responded the same way. Like if you gave them a bunch of Valium.
Okay.
Or a bunch of Prozac, it did the same thing. It's just inoculating their gut. Like it had almost exactly the same effect. So like they're thinking that maybe people with anxiety are just their gut is not producing the right those right signals from the microbiome. So it's not keeping their brain like in that middle.
Okay.
Part. So like it just like wildly fluctuates. Like you have a panic attack. Then you're on the bottom.
Right. So you're up and down.
Yeah.
And what is a microbiome?
The part of their microbiome that they're missing is the lactobacillus, like that type that's in like sauerkraut and like all that stuff.
Right.
But
so then, what is the deal then with like butter and like the when you talk about like the fat like the nature of your diet, for example?
But that stuff feeds that. It keeps the good that good kind alive, like in the bottom part of your gut. So like if you eat more like fatty, like more butyrate, like foods with lots of butyrate in them, that kind of feeds those guys at the bottom of your colon. That produce that anti-anxiety effect. Like it also heals the junctions in your gut. Like so if you don't eat enough fat, like the junctions they open up, and so like they release like bad stuff into your bloodstream, and that kind of keeps them. It kind of keeps that one cell layer between your bloodstream and your gut intact. So like that's what butter does, kind of heals the gut perforations and stuff. Kind of seals everything up. So you don't have like flood when you don't want it.
Do you mind if I ask you again, because I hate to repeat myself, but what was it that you were talking about the other day about the thing? I couldn't remember exactly the thing that you were doing that had that was about like the youth thing that you were kind of like, they were like your shit is weird when you went to the doctor. Telomeres.
Telomeres are like, the way most people describe it are like the shoelace, like the plastic end of your shoelace string. So like it keeps the rest of your shoelace from unraveling. So like you have that plastic tip, that's the hard tip. The telomeres are what is like the hard part of the end of your DNA strand, and like every time your cells reproduce, there's a potential for degrading that telomere, and that telomere kind of protects the end. So you can have a potential miscopy. So every time so that's what mutations in your DNA come from. Like every time you're exposed to like a toxin or radiation or something like that, you can have a potential miscopy that turn into cancer, like do all that stuff. But also, it's also implicit in the aging process. It's like that's like what aging is.
Right.
Like,
okay.
Pretty soon, like your body tries to repair itself, and every time you try to repair yourself, you have to produce more cells that replace those cells that are destroyed.
Okay.
And so every time you replace a cell, you have a potential for not replacing it right. Like it has like a miscopy in the DNA, so you don't do it right. So aging is just like the repair can't keep up with the damage.
Okay.
So you age faster if your repair can't keep up with the damage that you're causing every day from like environmental stress, all the other kind of stress that you put on your body. Like
right. And then what was the deal with yours?
Mine was like they're trying to determine. They had like 165 people at U of A that like volunteered to do like they wanted to be able to predict the age of a person just by looking at their DNA telomere length and saying, okay, well this person has their repair process is this good. That means they're really young. So when you're young, you have a repair process that's really fast. So when you turn 18, like it starts getting shorter usually. Like right when you pass like 18, 19, 20.
Oh. Okay.
22. 22 is like, so I was in the first cohort. I'm not 22, I'm like, 30, 39, 30.
Right.
And like, but they were saying like my telomere length was even longer than the average of the 18 to 22-year-old cohort. Like, so like I was in the 65th percentile.
Right.
From last year to this year.
And then it went
Got
down.
bigger. It got even longer.
Right.
So I was even higher in the like in my.
So like some Benjamin Button.
So I was like outside
stuff.
of the. So they had to throw my results out.
Right.
So since I was thrown out of the study, they could call me in and talk to me about it. And they're trying to figure out like the extremes. Like some people have really short telomeres, which is bad on the other side. Some people have really long telomeres, like me, like on this side. They were trying to figure out how. So they wanted more of like a family history, and they were trying to decide like how to explain it. Like when you throw people out of a study, you have to explain why. So you have to come up with like a reason why this person is not.
Right, because you were such an outlier.
Yeah, you have to have an outlier explanation.
Yeah.